I've been asked to talk about the use of theory in implementation research. So I'm going to attempt to share some thoughts about that with you. So happy you're all here. Sorry we can't be all in person. I've been at every one of the UK implementation conferences since the start, and really enjoyed meeting people and getting to know you all. So yeah, I'm going to talk about a number of different things as we go on, the need for specificity in thinking about theory. I'm going to talk a little bit about frameworks, what theories are, and if I have time, some brief examples of some of the work that we do in organizational theory and leadership and organizational climate theory. So, as you know, there are many frameworks. And within frameworks, implementation science frameworks, they aren't necessarily theories, although some of their components may have been drawn from theory. This seems to be advancing on its own, so I'm going to keep an eye on it. And so it's up to us as researchers to really think about what the components of a theory, of a framework are, and how theory might apply. So, theory may be implicit or explicit in implementation. So a lot of times the goal is really to be explicit about the theories that we're engaging and that we're testing. And so we can't test necessarily a whole framework, but within frameworks, there may be constructs, determinants, mechanisms of change that we can apply theory. So it's important to identify the appropriate theories of influence, change, and process in implementation. So we can apply those theories to components or dimensions of frameworks as we go ahead. So theory is embedded in frameworks, but it's not always explicit. And for any implementation project that you may do, it's really important to articulate your theories of change and theories of action. And I think one of the best examples of this is in Susan Mickey's work in the theoretical domains framework and the behavior change wheel, really applying theory to implementation and behavior change. So examples of theories that can be or have been applied to implementation: diffusion of innovations theory, theories of organizational change, like leadership theory, culture and organizational climate theory, social marketing, communication theories, for example, social network or network dynamics, influence persuasion theory, decision-making theory, what drives decision-making. Renad Betis and David Mandel at the University of Pennsylvania use behavioral economics as their driving theory for the work that they do. And other theories out of sociology, including institutional theory and resource dependence theory, can also be really useful. So these are just some examples of theory that can be brought to bear. But it's important to think about, where we apply theory. So is it at this larger system or environment level? Is it at the organization level? Do we have theories about groups or team operations? So team dynamics, do we have theories about how teams communicate? Do we have theories about how to enhance the effectiveness of teams? And then finally, at the individual level, do we have theories about individual behavior change? So important to be explicit not only about the theory, what you expect to change, but at what level it operates in implementation. So in terms of implementation frameworks, Per Nilsson, called out a couple areas of theory that some frameworks, models, and theories really address. So what he calls classic theories from fields external to implementation science, including psychology, sociology, organizational theory. And this is where some of those others come in: the diffusion of innovation theory, social cognitive theories, cognitive processing theory, decision-making, again, communities of practice, professional and organization theory. And then this other area that it calls implementation theories. So these developed by implementation researchers, original to implementation or adapted from existing theories and concepts. And the goal is to foster understanding or explain aspects of implementation. So things like implementation climate, theory about absorptive capacity, organizational readiness, normalization process theory. So there are these theories that kind of grew up in implementation science as well. And this idea of thinking about theory isn't new. These two articles published back in 2006, very early in the journal Implementation Science, and really identify the need for theory and where that fits in implementation science. However, there's been a number of systematic reviews, and sadly, theory isn't used very much. This study by Davies, Walker, and Grimshaw reviewed 235 studies. Only 6% explicitly used theory, 22% implicitly. There were 25 different theories used, and where they did use theory in these studies, there was a poor rationale for the use of the theory, so it wasn't clearly tied. So that's another area that we need to consider in using theory, is how well we have thought out how that fits, how the theory fits with what we're trying to accomplish. And in this Davies, Walker, and Grimshaw review, 4 theories were most used: diffusion of innovation, social marketing, information overload. Although there were 25 different theories used overall, there were these predominant theories that were most common. In another systematic reviews of theory in randomized controlled trials of audit and feedback, it was kind of similar results, a little disheartening. So we reviewed 140 studies, only 14% reported the use of theory in any aspect of the design or measurement, used mostly in implementation or interpretation, but 9% used theory to inform the development of the strategy of the intervention, and 18 different theories were utilized. Most common were diffusion of innovation theory and then Bandura's social cognitive theory in these. So again, a real need for the use of theory because that's what helps drive the science forward, the use of theory. So here's an example of looking at resource dependence theory and hospital contract management. In this study, they found that the importance of management effectiveness, regulatory climate, and hospital ownership were predisposing conditions for how well contracts were managed. So they use resource dependence theory to look at this process of implementation of contract management. I just want to say briefly, in the EPIS framework, as an example, just like many other frameworks, there are many constructs. So in the outer context of service systems, but in the inner context of organizations as well. And one of the things that we focus on is organizational characteristics and dynamics and leadership in the inner context. And if we look at that across the phases of the EPIS framework, exploration, preparation, implementation, and sustainment, leadership comes up in the outer context. In the inner context, this idea of organizational culture and climate and leadership is present throughout the phases. And in one of my studies, we had theories around implementation process, workforce impacts of implementation, and therapeutic process. But I just want to spend a minute to talk about this workforce process. This was a statewide implementation of an evidence-based practice, and we hypothesized that job autonomy would decrease because of having to do a structured practice and oversight and fidelity monitoring, that work attitudes would be more poor, and turnover intentions and staff turnover would be higher where the practice was implemented. So we had a theory drawn from the literature about this. And so this is where I get to tell you that I've never been happier to be wrong about this. What we found was that doing a survival analysis, where the evidence-based practice was implemented in this experimental project that was statewide, we had much higher retention of staff. So the turnover rate where the practice was implemented with coaching was 15%. And in the other conditions, over 30% turnover rate per year. So sometimes theory can guide us, but it's good to be wrong sometimes. Here's another example of use of theory on organizational climate, looking at both what we call molar climate or general organizational climate, and focused or strategic climate. And the theory here was that more positive molar organizational climate would improve implementation and CBT use, and more positive strategic implementation climate focused on improving the climate for cognitive behavioral therapy use would also be important. But no one had looked at those two together. So Nate Williams led this analysis, and what we found was that where you had a positive molar or a large, broad organizational climate combined with the positive strategic implementation climate, it improved use of cognitive behavioral therapy. So we came in with some theory and then were able to actually test that. But I want to say, and I'm going to wrap up with and open it up for discussion, that it's important to identify, often through a logic model, what you want to accomplish, what you think all of the important variables are, and what theories may relate to those. So this is a logic model that Teresa Betancourt, who does a lot of work in low and middle income countries on mental health, her work in Sierra Leone identified the different factors and then brought in theory to address how you would implement a group-based adolescent psychosocial intervention in this setting. What are all the considerations? And then applying theory to that process. So it's really important to lay out your expectations, then identify existing theories that can help drive that. And it's important not only in the science of the work that you do, but also in the practice of implementation to help understand what processes might be at play. And finally, it's important to be able to articulate theory if you're applying for grants as well. So I am going to stop there and see if we have some comments. Let's have a discussion. We have, oh gee, almost 15 minutes left, I think.
I was interested, you know, that when you said you'd never been so pleased to be wrong, that the theory had not played out as you expected. Have you been able to kind of follow that up at all and think about what happened with that?
Yes, and we did. And fortunately, this was a mixed method study, so we could drill down. And so we thought that the practice, which was called Safe Care, which is a child neglect intervention, very structured, and this is in a home visitation program statewide in the state of Oklahoma, and services had been pretty much the home visitor would go in, assess the situation, and come up with kind of a case management intervention plan. The feedback that we got was that the structure of the program fit very well with what home visitors were trying to accomplish in the home. So it gave them a structure process. And then we thought that the fidelity monitoring would also reduce job autonomy. But what we found through the qualitative work was that most of the home visitors saw that as a chance to case conference and get feedback on what they were doing with the families that they were working with. So both of those that we thought might be a reduction in job autonomy actually turned out to be something very positive. And this is one reason why I say every implementation study should be mixed methods if possible.
Yeah, definitely, definitely. Why do you think people have such an issue with using theory? Why do you think there are so many studies that haven't used theories?
I think we get caught up in the pragmatic parts of doing implementation. And so taking that deeper dive into the theory, I think is, it's an extra step. For me, it's a fun step to think about, how we apply different theories. And funding, it's also becoming more and more important, because there was a session earlier with Carol Lewis on this idea of mechanisms, right? So what are the mediators and modulators? What are the things that happen between your implementation strategy and your outcome? And it's really important to have a theory about those mechanisms. So if you have a leadership intervention that you expect to improve implementation and buy-in, how do you get there? Does it improve that strategic climate for implementation? Or as in Amy Edmondson's work in surgical teams, do effective teams create a psychological safety climate where the team operates more effectively and efficiently and can speak up if things go wrong? So that would mediate the relationship to the outcome.
Yeah.
So,
yeah. I think sometimes, certainly for me, I'm sort of quite new in my implementation science journey. It can feel like there are so many theories out there that it's quite difficult to kind of, get your head around which theory you might want to use. I wonder if that's sometimes an issue as well. It just feels like there's so many theories you could choose from.
Yeah, I think some of it is that, some of it is kind of discipline. Like if you come out of sociology, you may be drawn to the theories that come out of sociology. If you come out of like psychology, I think again of Susan Mickey and her work, very psychologically oriented theory. You're drawn to those, but there's theories in business and management, theories in public administration, theories in public health, so in a way, it's a bit like being in a candy shop. What flavor seems to be the best for right now?
Greg, I'd like to ask you something. Sorry, I saw that I posted my chat to only one person, but it was meant for you.
Okay.
For getting to know it as well. What is your opinion on combining theories? If you want to look at specific models and frameworks that have been used in specific context effectively, and for specific topics, for instance, my interest is in wound care in old age homes. What is your opinion on doing a thematic analysis or analysis of different theories, models, frameworks, and to identify the common themes and the strong elements within these?
Yeah, so I think combining theories is fine as long as the rationale is clear. So, we may look at resource dependence theory, for example, as in that one article, but you may link that with theories of leadership and organizational process. So, for example, if organization is implementing but resources are diminished, how does leadership respond, right, and lead through crisis, for example? So I think it's fine to combine theories. You just have to be very clear about, you know, what it is and why it is that they're being combined. Okay, and Ramesh has a question. Are there any theories which lend themselves better to studying implementation in different fields? For example, mental health, digital tools. Yeah, I think to some extent, although theories can be broadly applied, you know, thinking about digital tools, for example, you might be thinking about social network theories, right? And diffusion theories that could capitalize on the digital interface and digital world to help kind of promote implementation and scale up of those tools. I think, you know, for things like, you know, mental health versus cancer care versus smoking cessation, for example, I think it's broader and it depends a great deal on the context and the level. So I had that slide by Ewan Furley and Steve Shortell about the different levels. So thinking about, you know, if we want to change the climate of an agency that provides mental health treatment to reduce smoking, right? Do you change the culture? Do you change the environment? So thinking about, you know, broader kind of contextual theories, how does context impact the behavior of employees and staff? And is there, for example, theories of modeling or social contagion, where if you can get people to reduce smoking, will other people in that environment take the cue, right? So if you're trying to do something within mental health around smoking cessation. So I think the answer is yes. I couldn't say specifically which theories. I wish I had a chart that would do that. But I think in many cases, theories can be applied more broadly to the specific setting. And you have to kind of try them on and see what makes sense in a different setting. Other comments, questions? In the absence of questions, what I may do is, you can see if this sparks anything, some other examples, and I'm not going to use the slide timing. Hopefully you can see my screen again. One of the, I think, seminal studies in implementation in organizations was this by Catherine Klein. And there are really a number of theories inherent in this. Let's see. That, you know, when we think of theories of management and leadership related to theories of climate, there's a pathway or a mechanism in getting to implementation effectiveness or the outcomes. So management support influences implementation climate, which in turn influences implementation effectiveness. But these are related to resource availability. So remember I was talking about resource dependence theory and how that relates to policies and practices in the organization. So I think this goes back to Ramesh, to your question, can you combine theories? Yes, you can, and sometimes you really have to combine those theories. And then in this work by Amy Edmondson that I mentioned, they were looking at implementation of minimally invasive cardiac surgery and found that where you had effective team leadership, good organizational context, led to this psychological safety climate and greater implementation success. And when you think about the impact of implementing these and sustaining these more effective procedures, the impact on patient experience and patient care and outcomes, it's really quite striking. So you could bring in these theories about leadership, different dimensions of organizational context, and again, psychological safety climate, which is really that team level. So you can think about team operations. So you could bring in theories from team effectiveness as well in all of this. We have a question from Christelle, which is great. Is there an age limit on a theory? Should it be adapted at some point? So yeah, I think there is not an age limit on theory. If it's really relevant, as is, it can be utilized, of course. But if there is a need for adaptation, that's how science progresses. So by all means, think about how this needs to be, a theory may need to be adapted or shaped when thinking about implementation. Then we had a question from Nadine. You showed the papers earlier highlighting the discrepancy between the use of implementation theory. Why do you think this is the case? How does this impact the step between moving on from your logic model to identifying considerations, then identifying the theory to help drive it? Yeah, great question. And yeah, I think part of it is development of the field. I think, as I mentioned, there's more of a call for use of theory in our grant applications and being explicit about theory. So we're having to do that more and more. And you know, it can be helpful to have an overarching theory, as I mentioned at the University of Pennsylvania Center, where they're using behavioral economics as the driving thing. But you know, that may limit the purview of what they can look at. So organizational dynamics may or may not lend itself as well to behavioral economic theory as does individual behavior change, right? Or group modeling. And finally, from Rosie Gowron, occupational therapist, my current postdoc is an occupational therapist, Rosie. When is implementation really implementation? She said, I think you've just answered this, but yeah, I mean, there are lots of ways to look at implementation effectiveness, whether it benefits the patient or whether it's just getting something, the thing that we're trying to implement instantiated. But ultimately, implementation should be sustainable if possible. I like to say begin with sustainment in mind. As we think about implementation, think about the long game, and then is the implementation affecting the important outcomes that you intended, and are there other benefits? So for example, in Teresa Betancourt's work in Sierra Leone, they implemented the youth readiness intervention. It improved outcomes for youth affected by war and Ebola. But those youth started telling their friends and their siblings about what they were learning about their emotional regulation and working in the community. And so there's this natural diffusion that occurred. So the implementation was the implementation, but then it became more because it diffused out further. So now there's a theory of diffusion through family and social networks. So you could apply social network theory, diffusion of innovation theory. So there's just many, many opportunities for applying theory in different ways as we do implementation science. And I think that I am about out of time.